It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our first guest, Leslianne Yen, a sports medicine practitioner at Swedish, talking about nerve compression. Shannon, what is that exactly? Or maybe in the ballpark?
In the ballpark, a nerve compression is you have all these peripheral nerves, these nerves that go out from your spinal cord into your arms and legs. There are certain areas in the body where sometimes these nerves can get compressed from soft tissue restriction, inflammation. It's a pressure or compression situation. And what Dr. Yen's going to talk about is the treatment of those nerve compressions. A nerve is a very sensitive tissue, and it gets compressed. You have paresthesias, numbness, tingling, certain symptoms. So she's going to talk about that.
All right, Shannon O'Kelley and Leslianne Yen on Como.
Dr. Yen, welcome to Health Talk. How are you?
I'm great. Thank you. How are you?
I'm doing great. Thanks for joining us. Hey, you're a sports medicine doc, and we're going to talk about some interesting stuff such as nerve compression and those kind of neat things. But before we get into that, tell our listeners about your practice, your background, your training. I noticed on your bio as we were kind of talking off air, boy, Nashville, you've been all over the world kind of. Tell us about your training.
Yeah, so I trained in internal medicine here at University of Washington and then went to Vanderbilt for my sports fellowship, which is in primary care sports medicine, and then came back here to Seattle to start practice.
Yeah, and then you've been in practice in Seattle here, and your area of practice is sports medicine. Maybe talk about what does that mean? You mentioned the word primary care doctor. So, tell our listeners, you're a primary care doctor, but you have this fellowship in sports medicine. So tell us about the things that you see, the things you enjoy, the area of your practice. Maybe you have a specialization. Let's talk about your practice a little bit now.
Yeah, sounds good. Yeah, so sports medicine, there's different versions of sports doctors, sports orthopedic surgeons, sports podiatrists, sports physical therapists. So primary care sports medicine means that we do a primary care residency, so mine with internal medicine, and then you do a fellowship. And a lot of primary care sports medicine docs do 100% sports medicine, which is non-surgical musculoskeletal care. And some people also do primary care. But what I do is 100% sports medicine. My area of special interest is peripheral nerve entrapment syndromes. And I particularly love this field because it's challenging. Every case is a mystery, and we can make a big difference and restore people's quality of life. So that's what I really like to do.
Oh, absolutely. But tell us and tell our listeners, I know you know, but what is a peripheral nerve?
That's a good question. So the central nervous system is like the brain and the spinal cord, and peripheral nerves are everything outside of your brain and your spinal cord. So like when you hit your funny bone, that's a peripheral nerve, that's your ulnar nerve. Or when people have carpal tunnel syndrome, that's compression of a nerve in the wrist. So it just means outside of the spine.
Yeah, it's interesting. It's complex. Talk about nerve interventions. Talk about nerve travel, nerve paths. Let's get kind of nerdy here and talk about dermatomes and neat things like that. Okay.
Awesome. Yeah, that sounds great. Yeah. So nerve pain is actually quite deceptive. I think most people, when they're thinking about nerve pain, they're thinking about numbness and tingling. And actually, that's just the tip of the iceberg. Most nerve pain, in my experience, feels like a deep aching or something that's longitudinal. It can feel very muscular. And the challenge always is trying to figure out which nerve is compressed and where. And the way we figure that out is just getting into the history of what provokes it, where they feel it, and then adding that to the physical exam and looking for patterns of weakness.
Yeah, it's really interesting because those nerves, like you were describing, when they exit the spinal cord, they go out into the peripheral area, but they track and they run almost like a freeway system. So like if you have pain in certain areas of your body, what you're talking about is you're going to go, oh, look, I have numbness and tingling in this area. That is nerve number so-and-so. So you track it back. That's kind of what you like to do.
Yeah, so essentially every nerve is a bit of a mystery. Number one, when a person presents with pain that I think it might be a nerve, it's really a pattern of, or a challenge of teasing out, is the pain provoked by kind of your classic mechanical pattern, or is it provoked by things that are really dumb, like sitting, for example, can provoke nerve pain if the compression's in the groin, in the front, or the of the pelvis or the buttocks. And then based on where they feel it, figuring out if this is the sciatic nerve or the femoral nerve. And each nerve presents differently. So like, for example, if a person has compression of the femoral nerve in the groin, they usually will not feel numbness or tingling down the front of the thigh. They might have a muscular ache, or they notice that they catch their foot when they go upstairs because the muscle that lifts the leg is weaker than expected. On physical exam, we would corroborate that by evaluating for weakness with lifting the hip up, so hip flexion. We kind of put these pieces of the puzzle together to figure out which nerve it is.
More with Leslianne Yen and Shannon O'Kelley next on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation on nerve compression with Leslianne Yen and Shannon O'Kelley.
Dr. Yen, again, thank you so much for joining us here on Health Talk. And fascinating topic. We're talking about peripheral nerve compression. And you were recently just talking about in the last segment, kind of this femoral nerve as it kind of comes out and gets compressed. Nerves have different symptoms. We can have numbness and tingling. You have muscle ache. How do you discover where it's getting compressed, why it's getting compressed, and what do you do about it? Something's going on here.
Yeah. So, I think the key is really when people have a deep aching pain that is constant or more severe than you'd expect, then I look for a pattern of like a longitudinal spread. Does it fit with the nerve? And do they have weakness? And there's a lot of common ones, like tennis elbow often is actually a nerve compression syndrome, and we can pick that up because they'll also have weakness of a pattern that suggests that. And so the way to treat it is good ergonomics, so like a sit-to-stand desk is really helpful, excellent physical therapy, exercises, and oftentimes the thing that's very effective is a special injection called a hydrodissection, where we use sterile fluid, kind of like IV fluid, and under ultrasound, place it around the nerve where it's compressed to stretch out the soft tissue that compresses it. And it's covered by insurance, doesn't hurt very much. And we always combine it with ultrasound so we can look at the nerve directly and see if it's swollen, see if there's something specifically that compresses it. And that's a really effective treatment. Yeah,
the stuff you guys are doing today in medicine is just phenomenal. You have these abilities to look in and identify. It's almost like, sometimes I describe it to patients like your nerve is like a garden hose. And when it gets compressed, maybe there's tight tissue or scarred tissue. It compresses that nerve. And when that hose or nerve gets compressed, it eliminates the sensation going through. So you get those weird symptoms. You can actually see that compression and get that injection in there and relieve that. I imagine the relief is pretty instantaneous when you take some pressure off, isn't it?
Well, it actually takes a couple weeks in most patients.
Okay.
And part of the reason is as we introduce the fluid, we're adding pressure. So a lot of these patients have a lot of pain. And so temporarily for 3 days or so, it may ache more. Some people feel better right away, but I like to set the expectation that it's a couple of weeks out.
What kind of results are you seeing with some of this treatment? Because I'm telling you right now, anybody out there listening, if you've ever had nerve pain or compression, you know about it because it can be painful, it can be debilitating, it can cause muscle weakness, it can cause all kinds of different symptoms. What are your results you're seeing?
Yeah, it's entirely dependent on the nerve. So some nerves are very easy to treat, one treatment. Some nerves, they are compressed in more complex areas. And then that can take a little bit longer as we tease that out. But like the nerve that causes so-called tennis elbow pain, that usually responds to one injection. IT band pain at the side of the knee is often a nerve compression syndrome. Shin splints, that shin pain is often a nerve compression. And so that usually responds to one injection. But things like what people call piriformis syndrome, that buttock pain, that usually takes much more work.
That's a challenging one, though. I'm sure that piriformis one, that's that tough one. That piriformis can be tough. I mean, just identifying what is it can be hard, right? You know?
Right. Yeah.
We need to have you back on. We are out of time. And had a fantastic conversation with you and learned a ton. Thank you so much for your time. And let's have you back on in the future, and we'll catch up on peripheral nerve compression and entrapment. Thank you.
Thank you so much.
You've been listening to Leslianne Yen talking about nerve compression. You can get more information at Swedish.org. And Shannon, it's another, kind of a thing that we talk about. Usually this show is thought of as how to, get a sore calf or something in your knee taken care of. But these things are important too, and I'm glad that we're talking about them.
Yeah, if you have a compressed nerve or inflamed nerve or something that's pressuring a nerve, you're going to feel it. Nerve pain is definitely something that you can, it really can be limiting, right? It can be a problem for people.
Thanks to Leslianne Yen once again. We'll be back with our next guest after this time out on Como.